Technique is also important with children. How we're going to brush our children's teeth. We got to teach our children to brush their teeth also gum to tooth. Gum to tooth. No side to side brushing, and that's not only for us adults, teenagers, or children. We do not want to use sideways brushing. We want to teach our children, and I meet many children, little ones, and even teenagers whose parents or dentists have not corrected their brushing technique. We do not brush sideways. We must brush the gum 100%, but we must brush gum to tooth, whether it's circles down or just down. And if it's in the lower jaw or the mandible, we want to go gum to tooth, gum to tooth. Teach our children to brush the back part of our teeth sideways, but when it comes to the gum, we brush the gum always towards the tooth, gum always towards the tooth. That's very, very important. Parents, please teach their children to brush their gums. I see it on a daily basis where I meet older patients, younger patients, teenagers, and they didn't know, I had no idea they're supposed to brush their gums. Now for children, very important, 7 years and older. Younger, no, but older than 7 years old, we want to use toothpaste that has fluoride. Children tend to be more prone to cavity, especially if the diet at home or at school has high sugar. We want to make sure that they use fluoride, some type of topical fluoride. This is not enough to where they're going to ingest it and get sick, but we need to use some type of fluoride, especially nowadays down here in Florida, where fluoridated water no longer exists. They took fluoride out of the water, so we want to make sure our children, morning and night when they brush, that there's some type of topical fluoride in their toothpaste. I do believe in that. They need some topical fluoride, but then again, it's all in the technique that as parents, we teach our children how to brush our gums and our teeth. That's very, very important. We don't want to leave any plaque there, and we can teach our children to floss. When it comes to flossing, children have a hard time. We can floss their teeth ourselves and teach them how to do that, but the brand Gum Chucks have a smaller one for children. I've talked about Gum Chucks before. I love this tool. Parents can teach their children how to floss with it, and it works very well for not just adults, but for children or children with braces or teenagers with braces. Again, it has a little chucks, and we help the little ones how to floss with it, or we could help them by flossing them ourselves. For the children, I see so many parents just, the child wants gummy bears or they want Skittles or chocolate. And well, for the little ones, well, why not a little bit here, a little bit there. Some teachers, unfortunately, do give the kids in school candy. Now, it doesn't mean they can't have a little bit here and there on the weekends. If they go to the movies, a birthday party, that's okay. On an everyday basis, I don't recommend it. Same thing with soda at home with parents and juice for the kids. I don't recommend that. We want to have low sugar drinks or low sugar natural juices for children, but we want to stay away from candy or gummy bears or chocolate on a daily basis for children. We do not celebrate their accomplishments by giving them, or their behavior by giving them candy. Very important. Now, I think we all learn brushing techniques first from our parents before we meet our dentist. Parents, very important, how you're brushing your children's teeth. We want to make sure whether we use automatic brushes or manual brushes, they must always be soft or extra soft.